FAVMI presents Unfolding Mental Illness, hosted by Saraswati Suresh.
Hello, everyone. Family Voice on Mental Illness, FAVMI, is back with another episode on unfolding mental illness. We are also the Western Zone of Families Alliance on Mental Illness, FAVMI, founded by Dr. Nirmala Srinivasan, which is a pan-India collective of family carers supporting their loved ones with mental illness. Through our episodes, we aim to support family carers tending to their loved ones with mental health conditions. We try to empower them and educate the families, providing them with valuable tools and resources. If you are a family carer seeking guidance, understanding, and community support, we invite you to subscribe to our YouTube channel, favmi.in. I am Saraswati Suresh, founder of FAVMI and the host for today. And my co-host is Dr. Sachin Ganokar, founder, member, and director of FAVMI. This is our 20th episode, and our topic is Conversations on Family Therapy. And our guest for this episode is Dr. Veena Satyanarayana. Dr. Veena is an additional professor in the Department of Clinical Psychology at NIMHANS, Bangalore. She provides psychotherapy services for individuals, couples, and families through the Family Psychiatry Services, NIMHANS, and also the Couple Enrichment Services at the NIMHANS Center for Wellbeing. She supervises young trainees and has published on individual, couple, and family psychotherapy in peer-reviewed national and international journals. Welcome, ma'am, and we really look forward to having you with you a conversation on family therapy.
Thank you so much. It's a pleasure to be here to talk about families and their involvement in the context of caring for persons with mental illness. I'd like to thank Saraswati as well as Sachin for inviting me to be a part of this podcast.
Thank you so much. So, ma'am, to start with, the first question, if you can briefly explain what is family therapy and how does it differ from individual and couples therapy?
Okay. So family therapy is a type of psychotherapy, you can say. In this particular kind of psychotherapy, we see the entire family as opposed to seeing only the person affected by any kind of mental illness. So in family therapy, what we are seeking to do is to improve the quality of interpersonal relationships among all family members. So obviously the entire family is seen as a unit. We see the family as a system, and we try to help all family members over and above just the index patient, as we'd like to say, or the person affected by mental illness. In individual therapy, the focus is often on the person with mental illness, right? We see one individual, and that oftentimes is the patient who's affected by mental illness. In couples therapy, we could see the person affected by mental illness as well as, let's say, a spouse or a partner. Whereas in family therapy, the caregivers could be, let's say, a spouse, it could be children, it could be sometimes even extended family members that are caring for a person with mental illness. So whoever is really living with the patient as a family member becomes important for this kind of therapy.
Okay, so is it really important to have for the family to go through therapy, or, if the person is the loved one is going through some struggles in life through a mental illness, but does a family, he would be going through therapy and treatment, but does the family also need to go through? And if yes, why is it so important?
I think that's a great question. So we may not offer family therapy services to every person with mental illness. However, it becomes a very useful approach to treatment and care where we see family factors contributing directly or indirectly to the person's mental illness. For instance, take the example of an adolescent, right? There is a significant family pathology, a significant strain in the marital relationship of the parents. Parents are often having frequent altercations and arguments at home. All of this is impacting the adolescent. So then you know that the family factors are contributing to this adolescent's depression, right? Or this adolescent substance use difficulties. So in those cases where we identify family factors as playing a role in contributing or maintaining the person's mental illness or any psychological difficulty that the person has, then of course it becomes important to address these family factors through family therapy. But in another context, let's say, family is very supportive, but you identify more work-related pressures as contributing to a person's depression or anxiety symptoms. So you may not want to really engage with the family in family therapy, but really equip this individual in individual therapy to handle work-related challenges, right? So sometimes, you do find family is acting like a very protective resource for this person with mental illness, sometimes not. So I think it's important for us as clinicians to identify, are there family factors playing a role in this person's psychological difficulties or psychiatric problems at this point? And can we achieve better outcomes for this patient by addressing those family factors in psychotherapy? So if that is a yes, then I would, straight away see those people for family therapy.
Okay. So once you've identified and, the entire family has to go through therapy, so then they complement the entire process of this treatment. So what are the kind of tools and techniques that you use, and how do you measure the progress from an individual perspective and also from the family's perspective?
So oftentimes family therapy could be a standalone treatment. So let's take the example of minor mental health difficulties for which you don't necessarily require any medication or pharmacotherapy.
Okay.
And problems can be taken care of in the context of family therapy alone, right? So then family therapy could be a standalone treatment. Also in the context of couples that have, difficulty getting along with each other, right? It's marital discord per se, but it could be, some tensions in their couple relationship that they want to resolve, right? So these could be examples of standalone treatment. They don't require any other form of therapy really, or pharmacotherapy. But oftentimes, what we see, particularly in the settings that I practice in NIMHANS, a lot of patients are already, presenting to us with chronic manifestations of various kinds of mental health difficulties. For them, pharmacotherapy is indicated, maybe even individual psychotherapy is indicated, and maybe also family therapy. So we could offer this as an inpatient treatment or as an outpatient treatment. And these days, because online therapies have also become popular and, people struggle to access care, then sometimes online treatment also is provided, right? So in terms of how do we measure outcome, I think it is important for us to see, are we talking about, the gains that the index patient has made? Do we see better control over symptoms? Do we feel that symptoms are reducing because the family atmosphere is improving? Do we see more cordial interpersonal relationships? Earlier there used to be frequent fights and arguments, but today they are able to interact with each other a little more respectfully. They're able to communicate a little more respectfully. There is a little more warmth. There is a little more empathy for one another. So these are all probably indices that tell us that there is definitely and improvement and progress that we have made in these kinds of therapies. So again, the number of sessions that we take to achieve these kind of good outcomes for our patients could vary depending on the patient's psychiatric condition. For some people, maybe a few sessions of brief therapy, 6 to 8 sessions, to provide good outcomes. And for some people, maybe it has to be done over a period of time. And that could even be 20, 30 sessions of family therapy.
Okay, that's quite a lot of sessions. Yeah, I can understand. But I definitely agree with you, at least in my own case, the family therapy made such a big difference that the environment at home changed a lot. And, once you start understanding and empathizing the person, I think it made a lot of difference, and that safety net which we created. So I tend to understand from where you are coming from. Absolutely. Uh, so how can therapy help families navigate the unique challenges and help them balance supporting the person with mental illness without they getting exhausted or enabling their unhealthy behaviors? So how can family therapy help in that?
So I think family therapy does equip families with skills that they need to balance this a little better, a little more effectively. A teacher once told me that as clinicians, we are seeing the patient for an hour at most, right, at a given time. But a family is constantly living with them. So we can understand where the burnout is coming from, where the stress is coming from, how the stress finds expression in families becoming a little critical of the person with mental illness. So I think it's important not to blame them. It's important not to make them feel stigmatized, feel like they are less of a person because they're doing some of these things, or expressing some of these behaviors, but actually offer empathy to the family members, because what they've taken on and what they're doing day in and day out, is something all of us feel very humbled by. And I think we are here, therefore, to support family members so that they can support the person living with mental illness better. Families are a huge resource, and we value that resource, because otherwise, our government is not going to be able to provide support to all the people with mental illness that require support. But it is also important that we as mental health professionals understand the unique challenges that the family members are experiencing in caring for their wards, in caring for their children, spouse, parents, whatever the case may be, and see how we can enable them more, right? Should we teach them skills? Is that going to help them? Should we enable them with some self-care practices, which if they do regularly, they take care of themselves and they have a greater bandwidth to take care of the patient. They're a little more tolerant towards the challenging behaviors of the patient. Does the family member independently also qualify for a psychological difficulty that they are struggling with? And should we be, identifying that early and providing necessary treatment and support so that they are also taken care of? Because this can't be easy, right? This can't be easy for the person with mental illness, neither can it be easy for the family that is caring for them. So I think in family therapy, therefore, everyone in the family becomes important.
So beautifully said. And so true. Early intervention is the best treatment which can take place. I completely agree with you. And when it's out of my own experience, when it hits you first, as families, we don't understand also what is going on. It takes us also time to understand, yes, there is a need to look at it differently and, empathize with the person a little more of love and understanding. So I think, and then yes, self-care is, so that we don't get burnt out. Completely agree with you. Yeah. Over to Dr. Sachin.
Thank you, Saraswati. Thank you, Dr. Veena, for the wonderful explanation. So to continue what Saraswati asked, what role does communication play in family dynamics, and how can families improve it? So in terms of express emotion, or as Saraswati was mentioning, sometimes we are angry all the time. So how does communication play a role in family dynamics?
I think communication is the only medium we really interact and express ourselves through, isn't it? So communication does play a huge role, and a lot of family therapy is often working on these communication patterns and styles that family members have developed over a period of time. Some of it could have worked wonders in the past. They're not able to see why it's no longer working, right? Some of it could be a little problematic, and it gives us a chance to help them see why it is so and what can they do differently. I think a lot of communication, particularly in our culture, is also implicit, right? Family members don't like to explicitly say what they want, but they expect that it will magically happen. And when it does not happen, there is a lot of resentment, there is sadness, there is anger, right? But oftentimes it helps because not everybody is going to be very perceptive, right? And people with mental illness are struggling with their own concerns that unless you make it very clear, unless you make it very explicit, they probably don't know what you want. They probably don't know how they can help you. They probably don't know how their behaviors are causing more hurt, right? And less good, right? So I think clarifying some of these things becomes very important, and communication skills training, social skills training, negotiate skills to negotiate for what you want, negotiation skills, conflict resolution skills, problem solving skills, all take off from this, or even training in being a little more assertive and not so submissive and not so aggressive all the time. All of this really then becomes a way to communicate effectively and to make sure, therefore, that the interpersonal relationships are also a little more effective.
Thank you, Doctor. That was wonderful because I think express emotions and angry communication plays a very important role when these situations are there in the family. Just to extend it, what we see in our groups is that families feel helpless and hopeless in managing a loved one's mental illness. And how do you help families where the person is resisting therapy?
I think that is a very important point. It's also a sad truth. And I do understand a lot of families do feel helpless and hopeless at different points in perhaps caring for this person with mental illness. And sometimes the helplessness is more because the family is able to see that the person needs to go to a professional, but the person is resisting, right? And the family has tried pretty much everything. Today, we also have the Mental Health Care Act, which is very right-based, right? So even sometimes when the family is able to see it, they are not able to straight away, act by what their observations or intuitions tell them, because we need to also follow certain protocols, and all that to them seem more barriers than, facilitators or enablers, right? I think it is very important sometimes that the family members, irrespective of the patient's willingness, go and talk to professionals and see what guidance they can get from professionals directly as a family member. What are their options, right? What are their challenges at this point, and what suggestions can they get to overcome them? In case the person is unwilling to get help, you get help, right? You see what your options are. You see how you can overcome this or navigate this a little differently from what you've already tried, right? Oftentimes, sometimes we've also enabled families to take the protection of police when it comes to that, or seek legal recourse. Those options also become important, I would imagine. But sometimes I think offering emotional support to the family members who feel so stuck, who feel they've done everything and still they are not able to see progress, they begin to also give up, right? And we know that that is not going to be very helpful either to the family member or to the patient struggling with mental illness. So I think for a brief period of time, even if I have to just see the family members and not really the person with mental illness, I would see them. I would support them. I would, tell them that it's very important to focus on oneself. Leave the patient aside for a while. Let's see how you can get back to feeling how you were earlier before this hopelessness set in, before this helplessness set in. And then once they recover to some extent, take it forward from that point. Because until then, even though you're giving solutions, they are not in a emotional frame of mind to put it into action. So you have to help them heal emotionally first, and then maybe they'll be able to take the suggestions and execute them in a better way to help themselves, but also then help the person they want to help the most, that is the person with mental illness.
Thank you, doctor. That was a very good explanation. Uh, how can families maintain progress after the therapy session ends? And how do they set boundaries without feeling guilty? Because boundaries could be set within the family or with your extended relatives outside. So this is one question. And what are the resources and practices you recommend once the therapy ends for families to stay emotionally healthy while caregiving?
So I think it is natural human behavior that we are all very guilty of. Like if I have fever, I'll take medication for some time because I'm feeling so sick that I want to feel well. I'm very motivated to do everything that the doctor tells me. But once I start getting better, then I think that's enough. Who wants to unnecessarily take more medicines than you should? The same thing happens with therapy, right? When things are really bad, they're motivated, they come for treatment, they seek therapy. Once things start changing, they think, okay, now everything has gotten better. I need not continue to do anything more to sustain that improvement that we have seen as a family, right? That's where, problems then start resurfacing. If I stop doing all the good practices that I learned in therapy, I put it into practice, I started seeing gains. But after seeing gains, if I stop, or if we all stop, not just me, but all of us together, we just stop and we go back to our earlier ways, then everything is going to seem like it's going to sooner or later catch up with us and come back to what it was. So I think it will be very important for us to understand that there could be at least one or two practices. Obviously, all of us are leading busy lives. We have so many other things to take care of. We probably get to do at least one or two practices in a day to keep our mental health in check, and probably also, the family's well-being in check. So can I just make a commitment to doing just those one or two things which is good for the family, which is probably good for my physical health, emotional health, but it's also good for the rest of my family. So this could be maybe shared quality time as a family, which a lot of families find so hard to find a time that works for the entire family, right? But can we just commit to doing that over the weekends, if not every day? Right? Or can we have that one meal together to quickly check in on the other person, see, how they're doing, how their day was? We may miss 1 or 2 days when we are traveling or some other, issue takes us over. But by and large, are we able to keep up with some of these things? I think that would still be important to also review with the treating team so that in case you've not been able to catch something, maybe by the feedback you've given them, they alert you to something, right? So if you go for a review, that also, helps rather than completely dropping out of treatment and just making a crisis contact whenever things get really bad. So these are some things that we can keep in mind to make sure that it doesn't become so bad that we have to start over from scratch. That we can just keep doing 1 or 2 things to sustain whatever hard work we have put in as a family to ensure that, continues.
Oh, thank you, Dr. Thank you. That was very good. And uh, I think based on what Saraswati asked and what you answered, I think that's a very good understanding of family therapy, because uh, normally I think it only ends at medication and the family keeps struggling. So either the family keeps crying for help because people are still in denial about mental illness and what it does to the family. It's like a silent crisis going on within. So based on whatever we have discussed, would you have any final message for caregivers who are listening to this podcast uh, about how they can actually look after themselves, and what could they actually communicate? Because family does advocacy, so how can they actually communicate what kind of help they need from the society?
So I think, first of all, I'd like to tell all caregivers that I'm sure they're trying hard and doing whatever they can think of to support their children's spouse or parents or grandparents or whoever it is in the family that is affected, including siblings. I think as caregivers, if the family members take care of themselves, they're just able to provide a little better care to the person who needs it. So don't ever feel guilty about taking care of yourself or putting your interest first. Because if you are well, because you're really a precious resource to the person with mental illness, right? Their outcomes really depend also on you, right? If you're not as effective as a support system, their outcomes are going to be far worse, right? Try as we want in places like NIMHANS. Ultimately, without family support, even doctors feel very helpless, right? So I think first and foremost is probably to at least commit to doing one self-care practice a day to take care of yourself. It could be your physical health, emotional health, your, spiritual well-being. It could be, anything that you do. It could be exercise, it could be yoga, it could be meditative practices. It could be you engaging with your support system of friends and families, going on outings. It could be any of these practices that you continue to do, which just recharges you, which just refreshes and rejuvenates you, and helps you provide better care to this person with, any psychological difficulty or psychiatric condition that they may be struggling with. So I think that's the message for caregivers. I also want to say that don't ever feel bad about asking for help for yourself, right? Oftentimes, when they go to a mental health professional, they think they should only talk about the patient. Very rarely do they speak about themselves, right? So I think if there is something that you're struggling with, I know that not all settings perhaps practice family therapy, but maybe a quick tip or two the mental health professional can provide, which helps a family member. So don't hesitate also taking help for yourself when you need it, just to be a little more effective in whatever you may be doing for yourself and also for the person that you're caring for. So I think these two things I would like to highlight.
Thank you, doctor. I think that was very good advice for all of us, because all of us, like including Saraswati, me, and our family members, feel drained sometimes, and sometimes there is a lack of energy, and uh, sometimes even dealing with our daily lives and looking after a loved one becomes a very arduous pursuit. So I think it was a very good explanation and session and advice, and we would definitely want all our members to actually follow this and see that they can look after themselves. And also, as you rightly said, recharge yourself, so that because you also have to look after somebody, and maybe doing the good practices once you are on the good path. So thank you very much. And also I would invite Saraswati to say any last words. But thank you very much for your valuable time.
Thank you.
Thank you. Your key takeaways was of taking care of ourselves. Hats off. And also, I also like that continuity of treatment, which
Yeah.
you highlighted. I think that was also very key, because I also feel a lot of people, families, think that, oh, everything is going on well, let's stop it. We don't require it. Whereas I think that that was also a key takeaway which I take from this session. Thank you so much, Dr. Veena. And we are really humbled that you accepted our invitation and had a conversation with us. Thank you so much.
Thank you so much. I think the pleasure is mine to reach at least some of these messages to the wider community of families. Thank you so much.
Thank you.
Thank you.